Okay, so ready to dive into some fascinating research on fetal health. We're looking at C-section rates, specifically for babies considered small for their gestational age, right?
Right.
What if I told you there might be a specific ultrasound measurement that can, accurately predict if a C-section is going to be needed in those cases?
Really?
Yeah, and that's what we're unpacking today.
Interesting.
So we're looking at a new study from the Archives of Gynecology and Obstetrics, and it has some pretty groundbreaking findings. But first, it focuses on pregnancies that are past 36 weeks, where the baby is measuring small, or what's medically known as small for gestational age,
SGA.
SGA.
Yeah.
Now, before we even get into the details of the research, let's talk about the challenge doctors face when it comes to these SGA babies.
Sure.
It's tough to figure out which ones are just constitutionally small, meaning, they're healthy, but just on the smaller side, and which ones are actually experiencing restricted growth, which could then lead to complications during delivery.
Right. Right. Yeah.
It's kind of like, how do I put this? It's like telling the difference between, say, a naturally small breed of dog and one that's undersized because it hasn't been getting enough food.
Yeah, I see what you're saying.
Some babies are just meant to be petite, while others might unfortunately be facing some challenges in the womb.
Makes sense.
And that's where this research comes in. The study authors wanted to see if this specific type of ultrasound, called Doppler ultrasound, could accurately predict which SGA babies might run into trouble during labor.
Okay.
Specifically, cases where a C-section might be necessary due to something called fetal compromise, meaning the baby might be showing signs of distress. Think of it like an early warning system for potential problems during labor.
Okay, so if this measurement's so accurate, does that mean some C-sections could be, avoidable?
Potentially, yes.
Yeah.
But let's not get ahead of ourselves. So the researchers, they worked with a group of 87 pregnant women, all with SGA babies. They performed these highly detailed ultrasounds, measuring blood flow in different parts of the baby's circulatory system, and then they tracked how the deliveries went.
Wow.
And here's where it gets really interesting. Out of all the measurements they took, it was the blood flow in the umbilical vein, so that lifeline between the placenta and the baby, that turned out to be the most telling.
So if the blood flow is low, does that mean the baby's not getting enough oxygen? Could that be a sign of fetal compromise?
Yeah, you got it. Think of it like a
Yeah.
garden hose. If there's a kink in the hose, the water flow is reduced, right?
Right.
It's the same with the umbilical vein. If that blood flow is restricted, it could mean that the baby isn't receiving a steady supply of oxygen and nutrients, which of course are absolutely crucial for a healthy delivery.
Yeah, that makes sense. But they didn't just look at umbilical vein blood flow on its own, did they?
You're right. They actually found that looking at umbilical vein blood flow in relation to the baby's abdominal circumference, basically how big the baby's belly is measuring, that actually gave them the most accurate prediction of whether a C-section would be needed. They even have a fancy abbreviation for it, UVBFC.
UVBFAC, got it. So lower UVBFC, higher chance of needing a C-section.
Exactly. The study actually found that if that UVBFAC measurement was below the 50th percentile, so meaning lower than average, the risk of needing a C-section because of fetal distress during labor, it shot up by more than 8 times.
8 times. Wow, that's huge. So this UVBFAC measurement could be like a game changer for how doctors assess risk in these SGA pregnancies.
It really could. It's like having a more detailed roadmap for that birthing journey.
Yeah, totally.
And, we mentioned that the researchers, they looked at other blood flow measurements too, right?
Right.
But none of them came close to the accuracy of that umbilical vein blood flow, especially when it was adjusted for abdominal circumference.
So UVBFAC is like the MVP of fetal health predictors.
It seems that way, at least for predicting the need for C-sections in these specific cases, And it really tells us that umbilical vein blood flow, it might be giving us the most direct and accurate snapshot of how well the placenta is actually doing its job, that delivery of oxygen and nutrients to the baby.
Yeah.
And that's crucial information, especially when we're talking about a baby that's already measuring small.
Okay, this is all fascinating, but can we bring it back down to earth for a sec? I mean, what does this research actually mean for someone who's, pregnant with an SGA baby?
Right, that's the million-dollar question, isn't it? And, it is important to remember that this is just one study. More research is always needed.
Of course.
But if these findings hold true in larger studies, it could mean more personalized birthing plans for women with these SGA pregnancies.
Oh, okay, I like that.
Yeah, so instead of that one-size-fits-all approach, you could have a plan that's tailored to the specific needs of that baby, based on how well the placenta is
Okay,
functioning.
so it's empowering the parents, basically, right?
Okay.
Like
That,
imagine having a clearer picture of your baby's health and then being able to be more involved in those crucial delivery decisions.
exactly.
Like for example, if the UVBFAC is looking good, maybe that gives doctors and parents more confidence in trying for a vaginal delivery.
Right.
But if it's low, then it could be like, okay, maybe a C-section is the safest option. It's about looking at the whole picture, not just fixating on one data point.
Exactly. And speaking of the bigger picture, this study focused on SGA babies, right?
Right.
But could this UVBV-FAC measurement be useful for all pregnancies to assess fetal well-being and guide those delivery decisions?
That's a really good question. I mean, it's certainly possible, right?
Yeah.
And there's this, growing movement in medicine towards like personalized medicine. And this kind of measurement could be a really valuable tool in that approach.
Absolutely.
So instead of just relying on gestational age or how a pregnancy is, progressing in general, you could get a much more precise picture of how the fetus is actually doing at any given point.
Right.
Which has me thinking, I mean, this measurement, could this be game changing for all pregnancies, not just, SGA cases?
Yeah, and it could be particularly helpful in situations where there are other risk factors present, even if the baby isn't technically SGA.
Right, because every pregnancy is unique.
Exactly.
And having as much information as possible can only be a good thing.
Absolutely. Now, before we wrap up our deep dive on this umbilical vein blood flow research, there's one more thing I want to mention. It really highlights how complex pregnancy and delivery can be.
Oh, okay. What is it?
So the researchers, they looked at whether any of the Doppler measurements, including this UVB-AFAC, could predict whether a baby would be born with something called acidosis.
Acidosis.
Yeah, so acidosis basically means the baby's blood is too acidic. And what they found was that actually none of the measurements, not even the UVB-FAC, were able to predict that.
That's interesting. I guess I kind of assumed that if low blood flow can sometimes cause distress during labor, that would mean there's a higher risk of acidosis, right?
Yeah, it's a natural connection to make, but that's where it gets a bit, nuanced. While prolonged oxygen deprivation during labor, it can lead to acidosis. It's not the only cause.
Right, and it turns out that other factors can come into play during the delivery itself.
I see.
So what the study authors are suggesting is that the real value of these Doppler measurements, especially this UVB-FA, it might be more in making decisions about how to manage labor rather than predicting those long-term outcomes like acidosis.
So it's more about giving doctors the information they need to make like the best in-the-moment decisions for a safe delivery. Exactly. It's like we're not just looking at a still image anymore. We're getting real-time data that can actually guide those critical decisions. Let's say a doctor is monitoring a labor and they see that the baby's UVB-FEC is low, that could prompt them to intervene a little bit earlier, right? Maybe a C-section becomes the safest course of action right then and there. Having that early warning system, so to speak, could potentially prevent complications that might have otherwise occurred.
Yeah, it really underscores how technology is giving us this like incredible window into what's happening during pregnancy and labor and allowing for much more, personalized and responsive care.
It really does. And at the end of the day, isn't that what we all want? The healthiest possible outcome for both mom and baby.
Absolutely.
Absolutely. Well, I think that's a perfect place to wrap up our deep dive today. What started as a question about C-section rates for SGA babies led us to a potential game changer in how we assess fetal well-being and maybe even for all pregnancies, right?
Right. It's amazing how one research study can really open up so many avenues for exploration.
It really, really is.
Yeah.
And who knows? Maybe there are other fascinating discoveries that await us in the world of fetal health, and maybe we'll be back here again soon to unpack them together.
I would love that. There's always more to learn.
Always more to learn. Until then, thanks for joining us on The Deep Dive.